Today, as you can see, it's National Wear Red Day, and we are encouraging everyone else to wear red. This is to bring more awareness to women's heart health. So here to tell us more about this day and how you can help the American Heart Association is Krista Sharp, joining us via Zoom. Welcome, Krista. Thanks for coming and being even virtual. We're so happy to have you.
Thanks, Joni, so much for having me. Happy to be here.
So the American Heart Association, obviously heart health, and February being heart health, the month of love, and we want us to love ourselves. Tell me a little bit more, though, about the Heart Association and going red as we're bringing awareness, especially for women's heart health.
Absolutely. So today is National Wear Red Day, which happens every year on the first Friday of every February. And National Red Day is the American Heart Association's signature day to raise awareness and education around women's heart health. You know, heart disease is the #1 killer of all women, more than all cancers combined, and stroke is the #1 cause of death in women. So today is all about wearing red to show our support for women in our lives and donating and raising awareness around the issue.
So, Krista, when we talk about heart health and how much it impacts, how much of the community is impacted by that, I think it's important for women to understand too. You know, women are goers, and they are the nurturers and the caregivers for everyone else. And we really need to take time out to pause for our own heart health. And we think we know the symptoms, and yet what can be the symptoms of an impending heart attack, I mean, those could be things that we take for granted. They could be something we think is just an everyday normal aches and pain.
Absolutely. And like you said, I mean, us as women, we're always taking care of others, whether it be, you know, the kids or our jobs or keeping the house clean. I mean, we do a lot. And a lot of times, you know, taking care of ourselves falls on the back burner. And as you mentioned, the symptoms between men and women do differ. And people do not know that all the time. You know, a lot of people think of heart attacks and they think that, oh, it's this impending, you know, pressure on your chest, pain in your chest, which can be the case and typically is with men. But with women, we have a lot of different symptoms such as indigestion or nausea, fatigue, which, like you said, could signify anything else. You know, we could think that it could be any other problem and not a heart attack. So that's why Wear Red Day and Go Red for Women, the campaign, is important so that we can spread awareness and women know to look out for those other symptoms.
I think it's important too to remind these women, you know, to get those screenings, like we said. So the symptoms are different, and we often take them for granted. But the screenings, really, prevention is a key portion of all of this, of your heart health and your well-being. So, you know, getting those screenings, even if you haven't had those pains for an impending heart attack or another issue, having a screening can certainly calculate your risk of something to happen, and you can take those necessary precautions and make changes to your lifestyle early.
Absolutely. Those screenings and, you know, nutrition and exercise and, you know, staying away from tobacco and vaping. There are tons of things that we can do on the preventative side to keep our hearts healthy and prioritize our health as women.
You know, okay, so what we want to tell all the women out there, take time for yourself, go get your health wellness checkup done, and in case there isn't something that is completely well with you, now is the time to catch it and take the necessary preventative action for it. In the meantime, if you have exhibited those symptoms, get your heart checked out as well. Really and truly, we can't continue being those nurturers and givers if we can't take care of ourselves.
Exactly. That is very true.
All right, so people can donate, they can volunteer. There's lots of ways to get involved and certainly help to find more cures for heart disease.
Yes, absolutely. People can go to heart.org to learn more about American Heart Association and how to get involved, whether it be donating, volunteering, looking out for those signs and symptoms. And what I would say is, you know, a lot of people, when they talk about having experienced heart incidents, they think, I didn't think I was a typical heart patient. I didn't want to waste the doctor's time. What I would say to people is, you're not wasting their time. You know, the worst that they can tell you is, you're fine, go home, go on about your day. Just get yourself checked out, make sure that you're taking care of yourself.
Krista, thank you so much for joining us and taking time out of your day to make sure that the women of the world and the women of the big country are taking time out of their days for their best health ever. We want them all to be safe and live longer, happy lives and enjoy a few more Valentine's Days and February's out there as well.
Absolutely.
So if you'd like to get involved with the American Heart Association, you can find ways to donate, like she mentioned, and volunteer and find health tips. Those are all available at heart.org. You can also find them on Facebook for all the latest events.